My father is a physician in Northeast Pennsylvania. I was halfway through college and he said, you better figure out what you want to do. What are you good at? What do you enjoy? And, science was always the thing. I saw him as a physician and I just decided, I think this is probably the right path for me. I know he loves what he does. He tried his best not to get me to go into it, as any good father probably would, but I didn't listen to him and I'm glad I didn't. My name is Biscotti III and I am a cardiothoracic surgeon here at Penn Medicine. Patients have end-stage heart failure from what we call ischemic cardiomyopathy, so they have coronary disease that led to their heart failing, or on the lung transplant side, the majority of patients nowadays have an interstitial lung disease, pulmonary fibrosis, and of course we've had COVID-related end-stage lung disease. I'm aware that every day that the patient sees me, it's a normal day for me, but for them it's their worst day or the worst week of their life, and I take that to heart and I take that very seriously. We're really lucky here in the cardiac division at Penn Medicine. We have a great group of nurse practitioners and physician assistants and nurses and secretaries and other physicians who really guide them through this process. The goal is for it to be a relaxing and comforting environment, and for them to realize this is what we do. We do this every day. And for us, this is why we chose this. We're good at this and we enjoy it, and they should take solace in that. I think the size of our cardiac surgery program is sort of second to none. We have more attendings doing more specialized things than many other places. Everybody's truly an expert in their field, whether it's people specifically designated to do aortic surgery or specifically designated just to deal with heart failure or lung failure. I think that's unique here in that people are really, truly invested in their niche of cardiac surgery, and they're great at it. What inspires me is seeing our patients walk around the hospital and then walk out of the hospital. And a lot of them come in completely unrecognizable to their families. They have lines and tubes, and by the time they leave the hospital and then come back to our clinic, they look like a different person. Sometimes we don't even recognize them. And that's really inspiring to see people that sometimes you didn't think were gonna make it, that walk in with no wheelchair, no cane, and they're dragging their family into the hospital to see you again.